and welcome to This is 65. My name is Erin Ackenheil, and I own a company called Blackpoint Insurance. At Blackpoint, we help Medicare beneficiaries nationwide learn about and navigate the A, B, C's, and D's of Medicare. And through that process, we meet some pretty amazing people, somewhat like my guest today, who I'm excited to introduce. These are people who are entrepreneurs, they're side hustlers, they're doing amazing things in the community, authors, people who are dynamic speakers, who are helping people navigate their healthcare experiences across the board. And the stories are often very, very inspirational. And I'm very excited to introduce my guest today. This guest actually opened or launched DecideMed.com. She's going to tell us all about that business and what they do. Ema Drouillard is really a healthcare navigator. She helps patients and their family really navigate all the tough decisions along the healthcare journey in a situation where it's not always easy. It can be unnecessarily complicated, and she empowers both the patients and their family members to make confident choices. And she's a trusted advocate, and she's right there by their side. Ema's also a lifestyle coach. Her emphasis is on lifestyle improvements, which can complement your whole healthcare regimen. So I'm excited to bring her on the show today. She can talk to you about all the different programs she offered. So welcome from backstage, Ema Drouillard. Welcome, Ema. How are you?
I'm good. Thank you for having me. I appreciate it.
I've got our sign up here, so welcoming you. I managed, so we got it up there. Thanks so much for joining today, Ema. I know we've been working together for a while, and I was so inspired when I learned more about what you do and what you're doing out there for people in need. It's incredible. So thank you for your work. And just tell me a little bit. What's your story? What's your background? How did you get into all this?
One thing led to another. One, I'm really good about researching and gathering information, and people that know me know that. So it kind of started with friends that were going through really intense experiences and them asking for help, whether it's finding which medical center will, like for instance, one friend had thyroid cancer return, and they live half the year in California, half the year in Florida. They were trying to decide, should I go back to Florida and get this surgery, or should we do it here? Should I have the same surgeons do it again? Well, I was able to do the research, and one of the concerns was that they could easily nick a vocal cord and cause vocal damage. And so when I did the research, I found out that Stanford Hospital had equipment where that was not a concern. So she had the surgery at Stanford, which of course is excellent and is now cancer-free again. And it went really, really well because, it's at Stanford. But if she wouldn't have had that information, she wouldn't have known to call Stanford. And she would have been really worrying about the damage that could have been created.
So she's saying, should I do A or B? And you're like, actually, you should do C based on what the information provides. So I love it. And this is information that's out there available to people, but why are you so good at accessing it? Like, how did you learn this skill? How did this become your path to help people like this?
Well, I guess you could say that it started when I was a child with my grandmothers, mostly my grandmothers. When I would go back and visit, I would notice my grandmother kind of holding on to the door jamb to lift herself up the 2 stairs from the garage into the kitchen and do that in other parts of the house. So I immediately said to my dad, I said, we need a handle here. We need a handle here. Grandma needs things where she can just get herself up where it's more ergonomic and she's not going to hurt her wrist and things. So
how old were you when you were taking care of grandma? How old was this?
Grandma had a lot of surgeries. I mean, so many surgeries. Both my grandmas, my other grandma had cancer several times. They just, they did not have an easy go. And so in essence, our family was always assisting both of them. And even the one grandma would have to be helped up the stairs when we'd go places and things. So it was always present and always part of the family. And my eye was about how trying to find them ease. Let's get them
Right.
where that sends them up now because their thigh muscles have, decided not to work anymore and things like that.
It feels like a true calling, right? Because you saw this, it was in your family, and I mean, here you are a child and you're learning to advocate and it just became your story. Is that where you started out in your career originally, or did you do other things first, or how did you come to supporting others in your career?
In my career, I was in the hospitality industry for a long time. I was in finance. I was in real estate. I was in investing, and I was in the hospitality industry for a long time with weddings. The DecideMed came along because people that knew me would ask me, I need help with this, or would you research this? And I just go deeper than a lot of people go because
Right,
the deeper you go, the more you find out things that make the person feel comfortable in their decision. And when they feel really confident in their decision, their recovery is automatically going to go smoother.
right,
When they feel like they were in the right hands. Another client recently was at Stanford and things went wrong, but she still knew she was in really good hands. It just got much
right,
more complicated than what it expected to be. So
right.
when you feel that and you know that, it affects you in so
And your
many
outcome.
ways. Yeah,
Absolutely.
yeah.
So it's interesting because, well, you've been really a Jackie of all trades, right? You've done so many different things and done an amazing job, but now you're finally in your passion project, right? Because you're taking something you've always been good at and really being able to deliver it and serve, have a serving heart and help people through really, really challenging times.
Very
Um,
challenging.
yeah. So talk to me about the types of programs you offer at DecideMed, right? Because obviously you're helping people figure this out, but there's a couple of different paths they can take when they reach out to you. Is that true?
Yes. And there are different service plans, so it depends on which service plan they try. Um, some people just want to have their medications and their supplements gone over for a routine, right? So they can do things on an hourly rate, a weekly rate, a monthly rate. Those are available, and if they need something else, they can just
Kind of
ask.
reviewing their coverage almost and ensuring they have the right roadmap for their needs.
Right, right, yeah. I don't look at their insurance so much. I would probably send them over to you because
We're partners on that.
I only know a bit, my bit. So for something like that, I would definitely have them talk to someone like you. Um, so I'm not. I could possibly gather them information about insurance if they wanted that. You know.
Right.
Uh-huh.
Well, tell me this, Emma. So, say you're reviewing someone's medicine. What's the end game on something like that? Like, what are you looking for, and how are you helping them? Give me an example of something like that.
Well, I'm looking for interactions, even interactions with supplements versus medications. And when they take those medications, should it be with food? Should it be after you eat, before you eat, during when you eat? What foods you should avoid while you're taking these medications? I'll also look at the medications to see what kind of interactions they're having together and how can we deal with that. Also, I talk to them about, like for instance, one client that has had so many intense medical issues, and cancer being one of them. They had her on enough medications that her blood work looked stellar. So when they look at the numbers, they're going to go, you're good to go. But she had a whole list of issues that was happening for her on a daily basis
Right.
that were causing problems. So I was looking into the medications that might do that, information she can talk to with about the doctors about that, and letting her know that she had to talk to the doctors about that because she looks so good on paper. They're not going to assume any of those things are happening, you
Right. And
know.
knowing what questions to ask, right? I
Yes,
mean, so
that's a
important.
big one. Coming up
So, I
with
just want
questions before procedures and after procedures is just something people often need help with.
I just wanted to advise everybody out there. So if you go to DecideMed, so DecideMed.com, a lot of the information that Emma's talking about, you can get a little further details by going to the website. So just recommend everybody head to DecideMed.com and see if this might be for you and your family, because there's a lot of services that can be provided. And with information, it shows you can get a better outcome. You can end up being more confident going into a procedure or surgery. You might even be able to, through drug interactions and getting further information, prevent illnesses or symptoms that you might be experiencing that are unintended consequences of things that you might be combining. So, really, really helpful information. So, please go to decidemed.com and get further details. So, Emma, tell me a little bit about your typical client, and I know there's probably a variety, but if you were to say, here's kind of the profile of who reaches out to you, tell me a little bit about what that person looks like.
Well, the profile is for sure that someone's going through some kind of major health decision. I had one person I was working with in Alabama and having like 5 procedures at once. And some of them were going to have permanent consequences. And she was a person that could deal with a lot of information, and she wanted a lot of information. And even after she got the information, then we would talk and more questions would come up and then more information. So by the time she was with the Mayo Clinic in Florida. So again, great care. But there's no way they had enough time to deal with
all the questions and
just
all the options,
questions.
the ins and outs. And
by the time she made that decision, she was really clear of all the procedures, what she was doing. And then we were able to actually get all of the equipment, all of the things that she needed for her recovery on hand before she went in, so that she had it when she came back. And it was just a delight to be able to help her be as successful as she was through this process, just with information.
Emma, what you're describing sounds like you're the perfect combination of like researcher, best friend, advocate, counselor. I mean, you kind of do it all, right? Because I can even remember having something relatively minor like a knee surgery, right? Which is big for my life, but you come home and you don't know what to expect, and you don't realize you're not going to be able to take a shower, and the pain could be pretty severe, and not necessarily taking all those steps in advance because you just don't know to ask that. And the surgeon's just like, okay, you're scheduled, physical therapy in a week or whatever. And you really don't get that information. So I think, I wish I had known you then, Emma. You could have been my BFF to tell me what to expect, because that is really important. Yeah.
Even the Mayo and the Stanford, which I hold in really high regard, they just give you a little pamphlet and they give it to you before the surgery. So it's too late to get ready. I think people just need more information. They need often to go over it more than once. And they need to, and also, help them get those resources. Here's a link for that, and here's a link for that, and here's a video on this, and here's so some people can want a lot of information, and some people can only take a little bit of information.
Right.
Yeah.
Well, I mean, I think it's so helpful just because, how sometimes, and I'm sure this comes up for you too, is, okay, I've had a surgery and then I have something, a symptom or a feeling. Is that a complication? Calling 911? Should I just relax? How do I navigate through all of this? So I feel like you probably really help people in that way as well. Does that sound about right?
Because they get scared, because they weren't necessarily told, because everybody's going to respond differently. They weren't necessarily told this is what can happen, or you can feel like all your innards are about to leave. And that's scary.
Exactly.
So as soon as they have them, they can call me, and I look it up, and then we decide, okay, does the doctor know this is happening? Have you talked to the doctor about this, or the consulting nurse? Here's what you would want to ask them if they're concerned after they get the information. How do you approach the doctor on this?
That's incredible. And I just feel like sort of the hands-on support that you provide for every phase is the difference, right? It's not just pre, it's post, it's during, it's the experiences, and then how to deal with it. So pretty amazing, Emma. So I know some listeners out there are going to say, gosh, I want to talk to Emma and see if I might be a fit. I don't know what program I would have or whether I'd be a fit or not. What would you say is the best first step, Emma, for people to get in touch and have a little preview and see what they might be interested in?
I think whether you're the patient yourself or whether you're a family member, one is look on the website and see what you can find. Also, I write a lot of articles about different issues that also helps people. Sometimes that's helpful. But then reach out and we can talk and see if it's a fit and see what you need and go from there.
So the initial concept, or contact out there, everybody, for a preview call. This isn't meant to be a robust sort of intake, but just to check in with Emma to see if you're a fit for the potential programs and to get and gather more information. You can reach Emma directly at area code 415-302-0444. Again, that's 415-302-0444. And that's to kind of get a preliminary consult to see if this might be a fit for you. And then just want to encourage everybody for more details, and Emma may refer you there herself after you talk to her. Go to DecideMed.com and get more details. So DecideMed.com. So Emma, let's fast forward. I go through this process. I talk to you. I see how wonderful you are. I have my surgery coming up and I want to prepare for the before, during, and after. Gone to DecideMed. I've got an idea of my program. Can you walk me through what the experience is? How does somebody get into an arrangement with you? What steps do they need to take? How do they get started once you've decided you want to work together?
So on the site, they can buy the type of package that they're interested in, whether it's an hourly rate or a weekly or a monthly. They would sign the agreement disclosing how we work and what I need. Then I would ask them to send me the medical summaries that one or multiple doctors have given them. And we start from there. And then the first batch of information is going to be cited where that information is coming from if they have more questions about that. And then often after they receive enough information, the next step is to come up with a list of questions to ask the doctor so that the process continues.
And it morphs from there in terms of additional service that you need. That's amazing. I feel like that's a big gap. A lot of people, well, I work with a lot of Medicare beneficiaries who are seeing their doctor, and so many obviously do all their own communicating at the physician's office, but they don't say much, right? Because some grew up in a time when the doctor knows best and you just listen and you follow directions and you go for it. So you're really arming people with empowerment tools, right? To have the conversations and to look out for themselves. So no big surprises.
I've had my own medical issues, and it's been really important for me to feel like I'm making my decisions, that someone isn't making them for me, that I have enough information to weigh it and to have a say. And even when people go to the doctor, often what they're hearing is something they didn't expect. And so they'll hear the first unexpected thing, and their mind is busy processing that. So they don't hear the other 4 unexpected things that followed. So I always advise anyone, take someone with you to the appointment and then talk to them the next day, see what you get. Because I was hit by a truck at one time crossing the street, and it was very complicated and long recovery and so on. But when I went to the doctor, of course, I was in a tremendous amount of pain, and I asked a friend to come with me, which she did. And then the next day I was talking to her and I said, and she said, "Don't you remember the doctor said?" I said, "No,
I don't. Did I go to the doctor yesterday?"
Right.
I got the whole experience, right?
Right.
Oh goodness. So it does make a difference, right? A second set of ears is always a good idea. I even say that with looking at the healthcare insurance too. It's just somebody else to bounce the questions off of to make sure you're making good choices. So
right.
it really makes a difference.
It pays to have someone there that isn't emotionally caught up, someone that isn't perhaps in pain, to be able to follow and isn't emotionally attached to it, so they can follow it in a way that you're not really able at the moment. You're no fault of your own, it's just what it
No, of
is.
course.
Yeah.
Well, I would just advise out there, I mean, for anybody who's out there and has gotten a diagnosis or has information or has a family member who has received a diagnosis and it's just complicated. You don't know if you're getting all the information, you feel scared, you have fear. Contact Emma Drouillard. She runs DecideMed.com. Her phone number 415-302-0444. She's great. She's wonderful. She'll have a conversation with you. She'll treat you with the respect that you deserve and help you figure out how to navigate all this because we need advocates out there in the world, and she's doing wonderful work. So Emma, thank you so much for all that you're doing and for bringing this forward. I didn't have any idea, and I can't wait to send people your direction. So now tell me this: when you're not saving everybody from making mistakes and navigating, what do you like to do? What's fun for you? I mean, you've had such a diverse career. You work really hard. What do you do for fun?
Well, Marin is the perfect place to go and be in nature, and that is my medicine. And then, of course, to be in intimate social gatherings with friends in the area. Those two things really set me straight.
What's your favorite thing to do in nature?
I like to hike. And I'm an avid photographer, so I also like to photograph. I'll photograph anything, it seems. I used to really like to go around to events that were happening where some people couldn't get to it and photograph it and put them all up. So this is
Which is
what it
good
was
for
like.
Exactly. When you do your nature hikes, are you taking photos of animals or trees, or like what are you finding out in nature to
Whatever happens to appear, certainly animals appear, vistas, of course, appear. Um, whatever comes along, it's just the awe of the moment. I'm easily awed, and Marin is
it's
a
beautiful.
tremendous
It's
venue.
beautiful. Absolutely. Okay, I have to ask one more question on this. So I'm in Marin too, so I need to know, what is your favorite Marin hike?
Well, if I just answer that straight up, because I go to Phoenix Lake most often. That's definitely one of my favorites. I just love Phoenix Lake, but I certainly love to get up on Mount Tam too, because the vistas there are just
The
so
views are
incredible. And
amazing.
go up to Half Moon Bay when the mustard's blooming everywhere, and go out to Bodega Bay when there's a storm happening. We have so many
We're so
breathtaking
blessed. We
places.
really are.
Yeah.
So Emma, thank you so much for joining today. And when I think about you and your career, I mean, you've come so far. I mean, tell me this: if you were to reflect, look back and you say, 25-year-old Emma, hi Emma, how are you? What advice would you give to her? What would you say?
Don't work so hard. Don't take it all so seriously. Lighten up.
I need to tell my 50-year-old self that. That's a good one. I love it. So perfect. Great advice. Remind everyone, Emma, what's the best way to contact you for a consult?
The best way would be to call me directly at 415-302, pardon me, 0444. So it's 415-302-0444. Or check out the site at DecideMed.com.
Fantastic. Well, Emma, you are such a pleasure. You offer such amazing support and you're so diverse in all of your interests and everything you've done. You're just a cool person. I love getting to know you better. If you're going to send us off with a take home message about DecideMed.com and how to support loved ones during a time of need or crisis like this, what would your take home message be?
Don't enter into things that you don't fully understand. Be willing to ask questions, even if you think they're off target, or just go ahead and ask and get your questions answered. Don't be at all intimidated about that. And if someone is intimidating you, that's also something to notice.
100%.
Mhm.
Well, you heard it here, everybody. Thank you so much, Emma. You're such a pleasure. We appreciate you joining, and come back anytime.
Thank you so much, Erin. Thank you.